The most dangerous part of a heart attack is not always the first stab of pain. It is the silence that comes right after it. That moment when you look around an empty room, feel the pressure in your chest, and tell yourself, maybe this will pass, maybe I should wait, maybe I don't want to make a fuss. And for many older adults, that pause is exactly where precious heart muscle is lost. Minutes matter, not later, not when someone gets home, right then. If you live alone, spend long hours by yourself, or simply worry about what would happen if a medical emergency struck when no one was nearby, this message is for you, because a heart attack does not always arrive like it does in the movies. It can feel like pressure, squeezing, heaviness, breathlessness, nausea, sudden weakness, a strange ache in the jaw, back, shoulder, or arm, or even a wave of fatigue so unusual it feels almost unreal. And after 60, those symptoms can be more subtle, more confusing, and easier to dismiss. I'm Dr. Thomas Reynolds, and I want to talk to you the way I would talk to a patient I care deeply about sitting right across from me. Calmly, clearly, and without wasting a second. In this video, I'm going to walk you through the 3 emergency steps that can truly save your life if you think you may be having a heart attack and you are alone. Not vague advice, not panic. Real, practical actions you can remember under pressure. And please stay with me, because the final step is the one many people get wrong even after they've done the first 2. It sounds simple, but it can make the difference between getting help quickly and becoming much harder to rescue. Before we begin, if this topic touches a real fear for you, I want you to know that fear is understandable. It does not mean you are weak. It means you value your life, your independence, your ability to wake up in your own home, make your own coffee, walk your own hallway, and keep control over your own days. That matters, and knowing what to do in an emergency is part of protecting that independence. So let's make this simple. If you think you may be having a heart attack and you are alone, here are the 3 steps to remember. Step number 3, stop denying what your body is telling you. This may sound strange as an emergency step, but it is one of the most important. Many people do not lose time because they are careless. They lose time because they are hopeful. They want the discomfort to be indigestion. They want the tightness to be stress. They want the sweating to be nothing. They want one more glass of water. One more minute in the chair, one more chance for the feeling to fade. But when it comes to a heart attack, hope can become delay, and delay can become damage. A heart attack happens when blood flow to part of the heart muscle is suddenly blocked, usually by a clot forming over a narrowed artery. Think of your heart as a hard-working engine and the coronary arteries as fuel lines. If one of those lines gets blocked, the engine is still trying to run, but part of it is being starved the longer. That muscle goes without oxygen-rich blood. The more injury can occur. That is why early action is not dramatic. It is smart. What older adults often misunderstand is that a heart attack does not always feel like a crushing Hollywood chest grab. In many seniors, especially women, people with diabetes, and those with long-standing circulation problems, symptoms may be quieter. It may feel like a deep pressure in the center of the chest, a band tightening around. A heavy elephant-like weight. It may come with shortness of breath, nausea, lightheadedness, cold sweat, discomfort in the neck, jaw, back, or either arm. Sometimes it feels like a terrible wave of weakness, almost like your battery suddenly dropped from full to empty. And after 70, the body often sends softer signals. Nerves may not relay pain in the same dramatic way. Diabetes can blunt sensation. Aging can make symptoms more diffuse. So if something feels seriously wrong, new, intense, or out of character, do not wait for a perfect textbook picture. Here is what I want you to do the moment you suspect it. Stop what you are doing. Sit down. Place your hand on your chest if that helps you focus, and say the words out loud. This could be my heart. I am treating this like an emergency. That one sentence cuts through denial. It moves your brain from uncertainty into action. Do not start cleaning up. Do not go finish the laundry. Do not think, I'll see how I feel in 10 minutes. And please do not worry about embarrassing yourself if it turns out not to be a heart attack. In medicine, we would much rather evaluate a false alarm than arrive late to a real emergency, if you've ever had chest symptoms. Before and we're told it was reflux, muscle strain, or anxiety, do not let that old memory talk you out of responding now. Every event is different. New symptoms deserve fresh respect. And let me say something very directly to those of you who pride yourselves on being tough. Toughness is not ignoring danger. Toughness is doing the right thing quickly, even when you are scared. In a moment, I'll tell you the action that should come next, and it is the one that gets life-saving treatment moving toward you. But before I do, if you're watching this and you're over 60 or you're caring for a parent who lives alone, write your age or your loved one's age in the comments. Not for curiosity, for community. Because so many people watching need to know they are not the only ones carrying this worry quietly. Now let's go to the step that buys time, protects heart muscle, and brings real help to your door. Step number 2, call emergency services first, not family, not a neighbor, and not your own car keys. This is where many good people make a dangerous mistake. They call a son, a daughter, a friend from church, the lady next door, or worse. They decide to drive themselves. That feels reasonable in the moment. It feels practical. But it can cost you the treatment and monitoring you need when every minute matters. When you call emergency services, you are not just asking for a ride, you are activating a medical response. Paramedics can assess your oxygen level, heart rhythm, blood pressure, breathing, and symptoms right away. They can alert the hospital before you arrive. If your heart rhythm becomes unstable on the way, they are equipped to respond. A family member in a sedan is not. And driving yourself during a heart attack is especially dangerous. Why? Because heart attacks can trigger dangerous rhythm problems. Your heart is an electrical organ as well as a pump. When part of the muscle is starved of blood, the electrical wiring can misfire that can cause sudden fainting, severe weakness, or a rhythm so unstable you could lose control of the vehicle in seconds. You are not protecting anyone by driving yourself. You are increasing the risk. So here is the practical instruction. If you are having chest pressure, tightness, shortness of breath, or other symptoms that make you suspect a heart attack, call emergency services immediately. Put the phone on speaker. If your voice is shaky, that's okay. Say your address slowly and clearly. Tell them you are alone. Tell them your age. Tell them what you are feeling. Chest pressure, trouble breathing, pain in the jaw, cold sweat, nausea, dizziness, whatever is happening. If you have a cell phone, keep it with you at all times once the symptoms start. Do not leave it across the room. Do not assume you'll only need it once. If symptoms worsen suddenly, that phone becomes your lifeline. Now, some viewers may be wondering, should I call my family at all? Yes, but only after emergency services are on the way, or have someone else contact them if possible. Your first call is for medical help. Loved ones can follow, not the other way around. Another mistake people make is apologizing to the dispatcher, minimizing their symptoms, or sounding uncertain because they don't want to overreact. Please do not do that. This is not the time to be modest. This is the time to be clear. And there is another reason calling early matters so much after 60. Older hearts often have less reserve. Think of reserve as backup power. A younger body sometimes has more margin before it begins to struggle. But as we age, arteries may be stiffer, the heart muscle may be less forgiving, and other health issues like high blood pressure, diabetes, kidney disease, or prior heart damage may leave less room for delay. That does not mean you are fragile. It means timing matters even more. If you found this useful so far, take a moment to like this video and subscribe, because this channel is here for one reason: to help you stay informed, steady, and as independent as possible with real health guidance you can actually use in daily life. Now, once help is on the way, there is still one more step, and this final step is where you shift from calling for rescue to helping rescuers reach you fast while protecting your body in those critical minutes. Step number 1. Prepare your body and your home for rescue while you wait. This is the step people almost never rehearse, and yet it can save extraordinary time after you have called emergency services. Do not pace the room. Do not start packing a bag unless it is already right next to you. Do not go searching through drawers. Do not take a shower. Do not eat a heavy snack. Do not lie flat if that makes. Breathing harder. And again, do not decide to just get there faster by driving. Instead, make yourself easy to find, easy to reach, and as medically stable as possible until trained help arrives. First, unlock your front door if you safely can. If you have an apartment building, open the unit door if appropriate, turn on a porch light or hall light, and if you can do it without overexerting yourself, move to a place near the entrance. This matters more than many people realize. In emergencies, seconds disappear in locked doors. Dim hallways, barking dogs, and confusion. If paramedics have 2-4 sentry or spend time locating you, valuable minutes are lost. Second, sit in a comfortable position that makes breathing easier. For many people, that means seated upright or slightly reclined, not flat on the floor unless you feel faint and are instructed otherwise. The goal is to reduce strain. Your heart is already under stress, pacing, climbing stairs, bending repeatedly, or rushing around. The house only asks more from an organ that may already be struggling for oxygen. Think of it like this. If a room in your house has a damaged water pipe, you do not turn up the water pressure and run every faucet. You reduce demand. During a suspected heart attack, your body needs the same wisdom, less exertion, more stillness, more oxygen for the heart muscle that is fighting to survive. Third, if your doctor has previously prescribed nitroglycerin for chest pain and told you how to use it, follow those instructions exactly. Nitroglycerin can help relax blood vessels and reduce the heart's workload in some situations, but it should only be used as prescribed. It is not a casual medicine, and it is not for everyone. Never take someone else's nitroglycerin. Fourth, aspirin may be appropriate in many suspected heart attack situations, but this is important. Only take it if you have been told it is safe for you, and do not take it if you have an aspirin allergy, active bleeding, a history of serious bleeding problems, or medical reasons you have been told to avoid it. And if symptoms suggest a stroke instead of a heart attack, such as sudden one-sided weakness, facial drooping, or trouble speaking, do not assume aspirin is the right move. If you are unsure, ask the dispatcher or emergency team while help is on the way. If you have been instructed by your own physician in the past that you may chew aspirin in a suspected heart attack, then follow that plan. Chewing allows it to absorb faster than swallowing it whole. Fifth, gather only the essentials if they are within arm's reach. Your medication list, your phone, your glasses, and your identification. That's all. Not your entire file cabinet. Not a suitcase. Not a dozen pill bottles from 3 rooms away. If those items are not nearby, do not go hunting through the house. Your job is not to organize. Your job is to survive. Sixth, if you wear dentures and feel nauseated, or if you're chewing aspirin, be mindful of choking risk. If you use oxygen at home, continue it as directed. If you have a medical alert device, activate it. If you can safely send a quick text after calling emergency services, you can message a nearby loved one. Emergency called possible. Heart attack, please come. Short, clear, done. Now let me tell you the common mistake hidden inside this final step. People keep moving because movement feels like control. They clean up the kitchen, change clothes, feed the cat, wash the cup in the sink. They keep acting normal because acting normal feels less frightening than admitting what may be happening, but in a real emergency. Normal is not the goal. Safety is. The safest thing is to get still, stay reachable, and conserve energy. And here is the hopeful part. These actions are simple enough to remember even when you are afraid. Treat it like an emergency. Call emergency services first. Prepare for rescue and reduce strain while you wait. That is your sequence. Now, I also want to speak to those of you who have had unusual fatigue, chest discomfort with walking, breathlessness climbing stairs, or episodes of pressure you've been brushing off. Please do not wait for a dramatic event to take your heart seriously. The body often whispers before it shouts. If symptoms happen with exertion, return. With stress or feel new or worrisome, speak with your doctor promptly. A calm evaluation today may prevent a true emergency tomorrow. And if you live alone, I want to encourage you to make a small plan after this video ends. Keep your phone charged and near you. Put your home address on a card by the phone. Keep a medication list in an easy-to-find place. Make sure a trusted person knows how to reach you if you have nitroglycerin or other emergency instructions. From your doctor, review them now, not in the middle of chest pain. These small preparations may seem ordinary, but ordinary preparation protects extraordinary independence, because that is what this is really about. Not fear, not fragility, freedom. The freedom to keep living in your own home with confidence. The freedom to know what to do when your body sends a serious signal. The freedom that comes from preparation, not panic. Aging changes the body. Arteries may stiffen. Recovery may be slower. Symptoms may be less obvious. But common does not mean untouchable and getting. Older does not mean you are powerless. In fact, one of the strongest forms of self-protection at this stage of life is knowledge you can act on under pressure. So if you remember nothing else from today, remember this: do not wait to see if it passes. Do not drive yourself. Do not make family your first medical response. Treat it seriously. Call for help immediately, and make it easy for help to reach you. That is not overreacting. That is wisdom. That is self-respect. And that may save your life. If this video helped you, tell me in the comments what steps stood out to you most, or share whether you've created an emergency plan at home. And if you want more practical, compassionate guidance on heart health, circulation, energy, balance, and healthy aging, subscribe and join me again. I'm Dr. Thomas Reynolds, and I want to help. You stay informed, stay steady, and stay independent for as long as possible. Take care of yourself, and I'll see you in the next video.